Sam right here, question number 2, chapter 12. We're just going to go through these muscles real quick. First one we have is the sternocleidomastoid. Muscles running from the manubrium originating to the mastoid process. And so with, we'll do cervical lateral flexion. So to the side, running down to the manubrium. Next we have the splenius cervicis and capitis. So if you just want to like turn your chair around real quick, we'll do just the back of it. Yeah, we have it in your neck. Yeah, that'll work. Okay. Cervicis is originating in the spinous process of the 3rd through 6th thoracic. 3rd through 6th thoracic, and it's inserting at the transverse process of the first 3 cervical vertebrae. So first 3 cervical vertebrae coming down to about right here at the 3rd through the 6th thoracic. So it's about right there. So that would be your cervicis, and then your capitis is going to be, it's originating at the lower half of the ligamentum nuchae and spinous processes of the 7th cervical and upper 3 or 4 thoracic. So 7. And then upper 3 or 4, and then it's inserting at the mastoid process of the occipital bone. So it's coming almost all the way around the top. So it's pretty much coming down and about like that. Both of these muscles help out with cervical extension, cervical rotation unilaterally, and cervical lateral flexion. Next we have the erector spinae muscles. You've got the iliocostalis, longissimus, and spinalis. All of these muscles have to do with top to bottom of the spine. You've got lumbar extension, cervical extension, lumbar lateral flexion, cervical lateral flexion, lumbar rotation unilaterally, and cervical rotation unilaterally. So all these muscles play into all those movements. They're kind of hard to differentiate, but I guess just from the view you had, we'll go with the iliocostalis. It's going to come from the lumbar up, and it's the furthest away from the spinal column, from the vertebrae, and it's coming up, out, and attaching up in the cervical vertebrae. The longissimus is going to be a little bit closer to the spine, to the vertebrae, coming up, and then the spinalis is actually so it's actually attaching to the spine and coming all the way up. And the spinalis is inserting the 2nd cervical spinous process, thoracic, 5 through 12. And then the occipital bone. So it's coming all the way up to the top. Next we have the quadratus lumborum. Kind of difficult to palpate, but the 2 motions it helps out with are lumbar lateral flexion and lumbar extension. So just do a side bend real quick, side bend away. So it's at the top, iliac crest is going to be right here. So it goes from the iliac crest to the bottom to the 12th rib. Rib cage coming down to about right here. So this is going to be your quadratus lumborum. It's coming up and attaching like that. So down here in the lower back. Okay, the last 3 muscles are the abdomen. You've got the rectus abdominis. Yeah, do you want to stand up for this? rectus abdominis is going to be the muscle that comes straight down from the 5th, 6th, and 7th ribs in the xiphoid process, and it's coming all the way down, and it attaches at the crest of the pubis. So that is going to be your rectus abdominis. It's like the big sheet in the middle of the abdomen. And then the next two are kind of difficult to differentiate. I like to think of the external obliques as those which connect to the serratus anterior. It calls like dovetailing with the serratus anterior muscle. So your external obliques are going to be right up in here. Your internal obliques, it defines them as the upper half, originating at the upper half of the inguinal ligament, anterior 2/3 of the crest of the ilium and lumbar fascia, and inserting with the coastal region of the 8th, 9th, and 10th ribs and linea alba. So I'm going to refer to your inner as being lower and closer to the bottom of the rectus abdominis. So external obliques and internal obliques. So yeah, I think that does it. Yeah, that takes care of all the muscles that we're looking at.